Welcome to the High Yield USMLE Bites. Today we are diving into the meninges, a foundational topic for step 1. These protective layers of the brain and spinal cord are key to understanding neuroanatomy and related pathologies like meningitis or hematomas. Let's break down the essentials you need to know to ace those exam questions. First, the meninges consist of 3 layers. The dura mater is the outermost layer closest to the skull. It's thick and tough. Next is the arachnoid mater, the middle layer with web-like connections. Finally, the pia mater, the thin innermost layer tightly adheres to the brain and spinal cord. Check out the diagram. It shows these layers clearly along with their relationship to the skull and brain. Now let's talk cerebrospinal fluid or CSF. Its normal route is through the arachnoid space, which lies between the arachnoid and pia mater. The arachnoid is normal physiological space, and you can see the arachnoid granulations in the diagram as well, which help resorb CSF into the dural venous sinuses. Lastly, the epidural space. This is a potential space between dura mater and the skull or vertebral column, containing fat and blood vessels. It's a key site for blood collection, often due to injury to the middle meningeal artery, leading to an epidural hematoma, a classic step 1 scenario. First, on the left, we have epidural hematoma, right here. This occurs when the middle meningeal artery ruptures, often due to the skull fracture. Think trauma, like a car accident. The arterial blood collects between the skull and the dura mater, as shown on the red. On step 1, you will often see this present with a lucid interval followed by a rapid neurological decline, a classical vignette. Now on the right side, label B, is a subdural hematoma. This happens when bridging vein ruptures, typically in older patients or those with brain atrophy due to trauma or even minor head injury. The venous blood collects between the dura and arachnoid layers shown in blue. For step 1, note that subdural hematomas often present with a more gradual onset of symptoms like a headache or confusion compared to the rapid progression of an epidural hematoma. The diagram also highlights the superior sagittal sinus and the layers of the dura, reinforcing where these bleeds occur relative to the meninges. Knowing these distinctions is key for step 1 questions on neuroimaging and trauma scenarios. That's the meninges in a nutshell. These layers and spaces are critical for understanding neuroanatomy and related pathologies like hematomas or meningitis on step 1. Keep these points in mind and you will be ready for those exam questions. Please like and subscribe for more high-yield USMLE bites to ace your step 1